Welcome to Smiletown. This video is going to be all about deep sedation, or as we call it, sleep dentistry. My name is Dr. Andrew Adams, and I'm a dentist anesthesiologist, and all I do is treat children asleep. There's many reasons why kids choose to go to sleep for their dental work. Sometimes it's because they're too young to be able to cooperate. Sometimes it's because their age-specific attention span is too short to be able to hold still to get high-quality dental work. Other times, it's because the quantity of work is too great for them to be able to handle, or children can have specific fears, phobias, or anxieties. Think about a needle phobia. Medical reasons can also come into play, as well as parental preference. For example, many parents prefer to have work done in one appointment, and also the popularity of deep sedation has gone up in recent years, as a lot of parents are less comfortable with their children being held down for treatment.
What I'd like to do is explain how a deep sedation appointment works, as well as describe the consultation process. There are basically three parts of the consultation. The first is that we take a thorough medical exam of your child's health history, as well as perform a physical exam. The second is that we'll talk about teeth. And the last part is we put it all together and talk about how the treatment appointment will work.
On the day of the treatment, it is critical that your child arrive fasted, and that means nothing to eat or drink from 11 p.m. the night before. And that means no water, milk, or any food. The second most important thing for safety is that you tell us if there are any changes in your child's health status from the day of the consult to the day of the treatment. And that can be something as small as the symptoms of a common cold.
When your child arrives on the day of treatment, they can wear pajamas, bring their favorite stuffy, and we encourage them to bring a blanket. It's always a great idea for two parents to accompany their child to the appointment. That way on the ride home, while one parent is driving, the other can be in the back seat with their child. Once your child is ready for treatment, they will come into one of our fun operatories like this one, and they'll fall asleep by breathing through a little mask. It's as simple as taking normal breaths through a mask, and they will take somewhere between 50 and 30 seconds to begin falling asleep. Falling asleep with a mask can look a little bit funny. Kids might not close their eyes all the way. They may change their pattern of breathing, and they may squirm just a little bit as they're falling asleep. And this is all normal and totally anticipated.
Once your child is asleep, we'll start a little IV for them and place standard monitors. They'll be monitored the same as if they were having a simple operation under general anesthesia in a hospital. A dedicated team will look after them and ensure their safety throughout the appointment. You're welcome to accompany your child as they head off to sleep. However, once they are asleep, we do ask you to wait in the waiting area so we can have our full attention on their care. At this point, we're going to be taking you pictures, doing a very thorough exam, and we'll inform you if there are any changes. Then, it is time to fix teeth.
After all the treatment has been completed, we bring your child into one of our recovery rooms. They will sleep there anywhere from 15 minutes to about an hour. It varies by each child. Once your child is awake, we will give you our final post-operative instructions. We want your child to go home and have a nice quiet day, a movie and TV type of day. We want them to eat and drink, starting with fluids and soft foods, then progressing to diet as tolerated. We will give you all the specific instructions depending on the type of work your child has had. When both you and the dental anesthesiologist are comfortable, you are free to go home. We will tell you if your child needs any pain medicine. By the next day, your child should be feeling back to normal from a sedation perspective. We will give you a contact number where you can reach us with any questions afterwards.
Overall, sedation for children is very safe. This is why we always screen to make sure children are healthy for sedation. We tell parents that there's about a 1% risk of nausea. Kids can get a bit of a sore throat from breathing dry air, and they could get red or cracked lips from being open, especially in the winter months when it tends to be dry to begin with. Kids can also get a small bruise where they put the IV, but as you can probably guess, there are really minor side effects that resolve quite quickly. The risk of a major problem is never zero, but is incredibly small. We like to say there's nothing in life that is absolutely risk-free, but this is very, very low risk. Statistically, it is more dangerous to drive here by car than to have the appointment. The next part of your consultation today will be speaking with a nurse and one of our dentists and dental anesthesiologists. Feel free to ask us all the questions you like. We want to make sure you are very comfortable about your child's care. Thanks for your time.